Up Close is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
Thanks for joining us for this edition of Up Close. I'm Stephanie Aldrich. It sounds so simple. You're tired, so turn out the light, curl up, and just go to sleep. It's not always easy when life is delivering stress or other health challenges. Many of us are trying to get by on far less shut-eye than we should, having a negative impact on everything from our work performance or even making us drowsy drivers. But when a lack of sleep is keeping you from functioning during the day, or if you even stop breathing at night, there are serious health consequences. Thankfully, there are specialists that can help. We sat down with Dr. Dewey McWhirter to get some advice on getting a better night's rest and ultimately better health. Dr. McWhirter, how did you first get interested in sleep medicine? I understand you had some personal experiences that sparked your interest.
Yeah, when I was in my late teenage years and started college, I started having a lot of trouble where when I would try to go to sleep at night, it was kind of hard for me to do. It was hard for me to get up in the mornings. If I could be on a schedule where I really didn't go to bed till 2 or 3 in the morning and I got up around noon, everything was fine. But as soon as I had to switch over to a schedule where I was really going to bed at a normal time, getting up at a normal time, it was really difficult for me to do. What I really had is something called delayed sleep phase syndrome, which is fairly common among teenagers. Most teenagers do okay with it, but some teenagers do have more trouble with it. And it got me interested in sleep medicine, and I kind of went from there.
And I would imagine going into medicine and a doctor's schedule as well as your residency, that puts your sleep all over the map too. I'm sure it continued to challenge you along the way.
It did then, and it still does. I have to really kind of stick to a regimen where I get up and exercise every morning and try to avoid bright lights in the evenings and try to make sure I get lots of light when I first get up in the morning. And you know, some people grow out of it, other people don't grow out of it, and it was definitely a challenge during residency because you're kind of on a 24-hour work clock there all the time, and that can make it a lot more difficult to really control this problem when you're on that weird schedule.
You gave this a name, a syndrome with a specific name. Where does the syndrome with a specific name or disorder start and just your own personal habits end?
So yeah, that's one of the difficult things with delayed sleep phase syndrome is it can really be kind of a mixture of the two. And a lot of people will say that delayed sleep phase syndrome is a problem that's created by modern society. And it's the fact that we have all these lights out there that give us light when we're not really supposed to be having light, and that can kind of push your clock back and make it so that it's harder for you to go to bed at a normal time. It probably has a little to do with that, but there's a lot to suggest that it's not just that. You see this in cultures that don't really have electricity yet. The teenagers will still have this problem. But yeah, it is definitely exacerbated by our modern living with all the lights we have, the screens we have, that all exacerbates it.
That's what I was going to ask you as well, is how much of our own habits are impacting us today and making our good sleep harder to obtain, or just the need to always be connected, but also maybe the lights and the screens. And
right.
Is there really something to suggest that we really need to get away from that so many minutes or hours before we try to turn in?
Oh, absolutely, yes. That definitely impacts our lives. It definitely impacts how well we sleep at night. All these lights that we're encountering in our environment, from screens, from artificial lights, it all changes our melatonin system. Specifically, blue wavelengths of light will suppress your melatonin secretion. And when that melatonin secretion is suppressed, it makes you not tired till a later time, which makes people stay up later at night, and they're therefore less likely to be able to get up early in the morning. And it kind of suppresses how high your melatonin levels get, which probably affects a whole lot of other things. One of the biggest concerns with this right now is there was a study that came out a while back suggesting that the suppression of melatonin that you're getting because of light exposure while you're asleep might actually be increasing people's likelihood of getting cancers. So it's become a much bigger issue with a lot more attention in the last couple of years.
So what would you say are some of those first warning signs that you're sleep deprived, besides the obvious of feeling a little bit tired?
People can be irritable, they have trouble with their concentration, they have trouble with their memory. You can be achy if you're sleep deprived as well. People get upset stomachs sometimes with it. There's a lot of different symptoms that go along with it. what's surprising is how much people will kind of write those off to other causes and not really realize it's because they're sleep deprived.
Are there some basic recommendations as far as hours of sleep? I mean, everybody is a little bit different, but are there some, in your opinion, any kind of hard and fast rules that you really need your solid 8, whereas somebody else might get by on a little less? And how do you find, I guess, that personal best for yourself?
So really what you want to do is get enough sleep so that you feel refreshed in the morning. Most people are going to feel refreshed after somewhere between 7 and 8.5 hours of sleep at night. The vast majority of people, it's going to be somewhere around 7.5 to 8, but there are some people who can get away with less, there's some people who can get away with more, but the vast majority of people really needs to be somewhere between that 7 to 8.5 hours at night. And I think the best way for people to judge it is to kind of give yourself an opportunity to sleep as long as you can, and just see how long you actually sleep and see when you feel refreshed when you wake up.
What are some of the most, I guess, common problems that people come to see you for? I would imagine insomnia just in and of itself, and I know that can kind of is a little bit broad, but can you tell me more about that, of what someone is really experiencing if they have that?
Sure. When people have insomnia, it's usually a problem with either falling asleep or staying asleep at night. There's some sort of consequence to this. So they either feel they're tired the next day, they're fatigued the next day, they can't concentrate well, they have problems with their memory, they start to get drowsy while they're doing things during the day. There's a lot of different consequences that can go along with it. But typically we define insomnia as not being able to get a decent amount of sleep at night because you either have trouble falling asleep or staying asleep, or just feeling like you're not really getting good sleep, that you're kind of waking up a lot, or you're just not feeling like you sleep very deeply.
Right. And that can be very frustrating, right? I want to fall asleep, and it's just very hard to break that cycle, I imagine. It's
very frustrating to people, absolutely. It can be very difficult sometimes because patients start having a problem sleeping, and the problem actually gets worse because you sort of develop this expectation of insomnia. You expect to not be able to get to sleep at night, and as soon as that happens, you're getting into sort of a cycle that's just going to feed itself over time.
And so what do people do to start fixing that, to start correcting that?
You got to break the cycle, and typically there's a lot of things you can do. The first thing I usually tell people is, if you think you've been in that bed for 20 minutes and you haven't fallen asleep yet, you should get up, go to another room, sit there looking at a book or magazine in low light till you're asleep again, then come back and lie down again once you're feeling sleepy again. Staying in that bed a long period of time, just feeling frustrated, is just going to make you have more problems the next night. And that's not what we want. We don't want people to continue to build this feeling of frustration with the bed. The bed needs to be a place that is relaxing, and it needs to be somewhere where you can kind of passively fall asleep and you don't have to feel like it's an effort.
Sure. Maybe don't do work in there, kind of just make it, associate it just with sleeping.
You don't want to work in the bed, you don't want to use a computer in the bed, don't watch TV in bed. Some people can get away with reading in bed, but most people who are having insomnia, they should kind of move that out of the bed also.
Let's talk about some of the other issues that you see with some of your patients, and I know there's different kinds of apnea. Can you talk a little bit about those?
Sure. So sleep apnea is a very common problem in sleep labs. Sleep apnea involves a decrease or a stoppage in your breathing during the night, and this can happen numerous times throughout the night.
That's scary.
It is scary, yes, and it's surprising. Sometimes people realize that it's happening, other times people don't realize it's happening. And it can be very scary to the bed partner as well, because they're watching the person stop breathing repeatedly, and sometimes they hear them snore, sometimes they will hear them kind of gasp for air during the night, and sometimes patients will realize they're gasping for air at night like that. But there's really two main types of sleep apnea. There's obstructive sleep apnea, which is where your airway gets blocked, and that's usually either by your soft palate falling back, or sometimes it's actually your tongue falling back, or it can be the sides of your airway collapsing at night. And that's the most common type of sleep apnea. There's also what we call central sleep apnea. Central sleep apnea is where your body doesn't put the effort into breathing like it should during the night. And central sleep apnea can be related to medications, can be related to heart failure. There's a couple of different things that can cause that.
And then, so a lot of times are they not even aware of that until their partner might say, you stopped breathing, or they feel they're just so fatigued, and then they come and see you, and you hook them up, they go to the sleep lab, and then you can actually see that during the course of the night they actually stopped breathing.
Correct, yeah, we can actually see it happening on the sleep studies. You see their decreases in their breathing with sensors that we have to detect their breathing, to detect their body's actual effort to breathe. You can see their brain waves. Through all this data, we're able to figure out what exactly is happening. Are they having these decreases and stoppages in their breathing? How bad is their oxygen getting when this happens? And how often are they waking up from it?
How common is this?
About 5% of the population has sleep apnea. It's probably kind of gradually going up as we've had more problems with obesity in America, but it's probably still about a little over 5% at this point.
And then once you realize what the issue is and that this is actually a real problem happening at night, then how do you start then to correct this and help people with sleep apnea get a better night's rest and make sure they stay breathing through the night?
Right. So what we have to do is we have to find some way to keep the airway open. That's typically what we're doing. So the most common treatment is what we call CPAP, or continuous positive airway pressure. That involves a mask that goes under the nose or around the nose, or sometimes it has to go around the nose and the mouth. There's a tube that goes to a little machine that sits next to the bed. The machine blows in air and props the airway open with that air. It works for most people, which is why we really consider it to be the treatment of choice. But there are alternative treatments. There's surgeries that ear, nose, and throat doctors do. There's oral appliances people can wear at night that kind of pull their bottom jaw forward. And there's a few newer devices that are out there that they're kind of researching at this point. But really the main treatment is CPAP, just because it's much more likely to work than the alternatives are.
At first people must be thinking, how in the world am I going to fall asleep wearing this, right?
Most people actually do really well with it. It's actually one of the most tolerated treatments in medicine. It has about a 70% compliance rate if you take everybody in America who's been put on one of these machines. And so it's a fairly well-tolerated treatment, but I agree. When you first look at it, you go, how do you sleep with that on your face? But they've got newer masks these days that kind of address different problems people have. If they're claustrophobic, they can try what's called a nasal pillow that goes underneath their nose. There's also masks that kind of go around the edge of the face to address other problems patients have. There's a lot of different masks out there to address various different problems people have had with using these.
And how long, or is it just kind of indefinite, they have to be monitored? Is there any, how long does someone expect to have to use one of these? Is it indefinite? Is it usually a short term and then they can go back to sleeping on their own again regularly? Unless
something changes, it's usually for life. You're usually using the machine from then on. Sometimes when people lose a lot of weight, it can make a big difference with it. Sometimes they'll get the surgeries that ear, nose, and throat doctors do, and that can make a difference. But most of the time, you're going to be using this machine from now on unless something like that happens.
And when someone has one of these machines and then later come back to you, do they even realize what the sleep they were missing? Like, you don't know, sometimes you don't know what you don't know. You don't know what you're missing. What are some of the success stories that you've heard as a result of that?
You see a lot of patients who will come in and they'll say they're very sleepy, but you also see patients who will say, I think I'm doing okay. I've seen lots of patients who've come in, thought they were doing okay, and then when they start using the machine, later on they come back to us and they say, well, you know, I've started exercising every day again, I have more energy, I'm doing better at work, I'm able to pay attention better. We'll have students who say they're able to pay attention in class better. You see all sorts of different success stories. That's one of the nice things about sleep medicine, is that a lot of people will have a great improvement in how they feel and how they function in life when you treat them.
As far as having the sleep study done, kind of walk me through that process, because it might be hard to relax when you're having a sleep study done, right? And especially when you're trying to fix an issue as well, but when you have a lot of equipment and things monitoring your every move in your sleep. Can you walk me through some of those steps?
Yeah, that's another one that I was always surprised when I first started, that people could actually sleep while they were doing it. So typically when you have a sleep study, you're going to have some things on your head that are electrodes to monitor your brain waves. There's also going to be some electrodes on your face to monitor your eye movements. There's going to be some things that go underneath your nose to monitor your breathing during the night. There will be an electrode on your finger to monitor your oxygen levels. There are belts that go around your chest and your abdomen to monitor your breathing during the night. And then there are electrodes that go on your legs to monitor leg movements. So it sounds like a lot of equipment, it sounds like it'd be really hard to sleep with, but actually the vast majority of people end up sleeping pretty well with it. I'm always surprised and impressed with my patients with how well they sleep with it. Sometimes you know ahead of time people are going to have problems and you have to give them some sort of sleep aid to help them sleep during the study, but most people sleep pretty well without something like that during the study.
And there's video as well?
Yeah, there's video. Somebody's watching you throughout the night. There are sleep technicians who are monitoring you during the night to see if you're having sleep apnea and do they need to do something right then, or can it wait till the next night, or they kind of monitor your progress throughout the night and make sure electrodes aren't coming off and make sure that you're not having anything going on in the room that they would need to run in and take care of.
Are people sometimes surprised when the results of the study are revealed to them? How surprised are people when they think, "Gosh, I didn't realize I would do that"?
Right. It varies a lot. I mean, some people come in and they see it and they go, "Yep, I knew it. I knew it." But you'll have some other patients who are very surprised at how bad the sleep apnea is. And I've had a whole range of reactions. I've had some patients who really thought, you know, must have terrible sleep apnea, and then you do the study and you go, well, you don't really have a lot of sleep apnea. There must be something else going on we need to address. And I've also had patients who came in saying, I'm positive I don't. My wife says I'm snoring. Then we do the sleep study and they've got pretty bad sleep apnea. So it kind of runs a wide range of reactions to it. But I think the more important reaction is later on when you treat the sleep apnea and they're feeling better. That's the more important reaction, really.
You touched on this a little bit earlier, but this is not something like you just come in, get a prescription, and then it's fixed. This is something that has to kind of be worked on a little bit once you have a diagnosis, and the doctor can certainly help you get there, but there has to be, I guess, some consistency in things on the patient's part after that to try to make a better night's sleep so that they can feel better and just do what they can with being consistent in things too, I would imagine, right?
Absolutely, yeah. So it takes work on the patient's part too. It's kind of a team effort between the doctor and the patient to be able to address the problems that the patient's having, both from a medical standpoint and from their own personal behavior sort of standpoint. There's a lot of things people do that aren't really conducive to getting a good night's sleep at home. And so they kind of have to work on those things, and we try to help coach people through that so they'll be able to address this at home and have confidence that they can control their sleep and they can get themselves into a better situation where they're sleeping better at night.
What would you say are some of the most common pitfalls that maybe people don't realize are really just sabotaging their sleep, even if maybe they don't have a real huge disorder or something like that going on, but just they think maybe they could get a little bit better night's rest? But what are some of the things that people are maybe sabotaging themselves with?
There's a lot of things. Caffeine actually is a pretty common one. People will have caffeine fairly late in the evenings. We typically tell people to stop caffeine for at least 6 hours before bed. Alcohol can kind of sabotage your night sleep also. We tell people, you know, try not to have more than 2 drinks and try not to have your last drink more than 2 hours, any later than 2 hours before you go to bed at night. There's also people keeping lights on at night, people keeping the TV on all night, people keeping the radio on all night. All those things are going to disrupt your sleep at night. Having the pet sleep in the bed, unfortunately, is not conducive to getting a good night's sleep. Having your work in the bed, having your stress in the bed, you really need to leave that out of the bed. So if you lay down that bed at night and you start thinking stressful thoughts, you need to get out of the bed. That's not the place to do it. It's not a place to be on computer screens.
Sleep shouldn't be such hard work, should it?
No, it needs to be a passive thing where you lay down, you passively fall asleep. Once it starts feeling like work, you need to change the things that you're doing to fix it.
Once someone identifies the problem, and I know there's no magic number here or anything like that because, you know, there's different degrees of any kind of an issue that someone's having, but once a problem is identified, how long do you think someone can expect before they can start seeing things getting better for themselves?
Well, it really depends on which problem. So I would say with insomnia, it can take a while because usually it's been a while that people have had the problem. They have to unlearn the insomnia. So that can take months sometimes, but that's part of why you have to be there to support them and help them through these things. Sleep apnea, a lot of times people start using the CPAP machine and the next day they feel fabulous. They're doing much better. But I would say typically it takes a few weeks before people really get to where they can use the machine very consistently. They understand how to address problems that they might have with it. And so I'd say most people with sleep apnea can vary anywhere from a couple of days to a couple of weeks before they really notice a difference. Restless leg syndrome is another one we treat, and a lot of times with restless leg syndrome, it's kind of nice because there are medications that work really well for it. So a lot of times you give people medications and they're better almost immediately. So.
Do you feel like there's anything? There seems like with medicine, there's always improvements being made to things, but do you feel like with sleep medicine there's some tried and true techniques that are good to stick with, or are there some new things that you've seen recently that you think are extremely helpful for patients depending on what they're dealing with?
Well, I mean, sleep is nice because it's definitely a growing field. There's always new discoveries going on with it. They are coming up with new machines all the time to treat unusual types of sleep apnea. They are coming up with new medications to treat insomnia. They've come up with different non-medication ways of treating insomnia in the last couple of years that are great. They've come up with new medications to treat restless leg syndrome, but there are tried and true things. I mean, there's a lot of behavioral stuff that is definitely tried and true. So if you can lay down at night, let your mind be at ease, not think stressful thoughts, try to avoid that in the bed, try to make the bed a place for sleep, and that's just about it, then that's a tried and true way of getting a good night's sleep.
What are some of the non-medication ways to treat insomnia?
Well, really the best thing is what we call cognitive behavioral therapy for insomnia. And that's where you work with a psychologist who's trained in insomnia issues. We usually work with the cognitive behavioral therapist. They will work on relaxation techniques. They'll work on helping people to clear their minds when they lay down at night. They'll kind of retrain them on how to just passively fall asleep at night. And of course, they also help them with those sleep hygiene issues, keeping the lights on and using computer screens and that sort of thing in bed also. There's other things they'll do, like what's called sleep restriction therapy, which sounds scary to people when you first mention it, but actually works really well. Typically with sleep restriction therapy, patients are given a chart to fill out where we figure out how much time are you actually sleeping now. And then we say, okay, that's how much time you're going to have in the bed every night. And typically over time, as you're only in the bed about the amount of time you're typically sleeping at night, you start to think of that bed as only a place for sleep, and you quickly start building up the amount of time you can sleep at night. So there's a lot of things that are more conservative sort of measures like that we do to treat insomnia.
As a mother, I always joke, but I wonder if there's any truth to it. Do you become a lighter sleeper suddenly when you have children, just trying to be in tune with their needs? Because I used to sleep like a rock, and not so much anymore.
You hear that a lot, actually, yeah. And part of it is probably just as we get older, we sleep lighter. But also, yeah, when you have a child, your mind kind of changes a little bit. You're kind of listening for that child to make a noise at night to know that you need to go there. So you definitely see that. I try to reassure parents sometimes, because sometimes they do get very sort of hyper aware of their child when they're trying to sleep at night, that you know, more than likely your child's going to sleep through the night and everything's going to be fine. And so, yeah, you definitely see that with parents sometimes.
Do you ever have to find yourself stressing the importance of people taking their sleep seriously, meaning that it's just better for their overall health, but also things like, I think about people driving kind of drowsy on either their commute in the morning or in the evening. I imagine those are things that have to come up in conversation from time to time. Yeah,
they definitely do, and that's always a concern. People do have car accidents more often when they are drowsy. When they have sleep apnea can make you more likely to have a car accident. So we always have to address safety issues. It's also an occupational issue. When people have jobs that involve them having to be very aware of what's going on, you need to make sure they're not going to fall asleep. And so it's a safety issue with that as well. They really need to be able to be aware of what's going on around them and not be falling asleep unintentionally.
It's just impossible to be your best if you don't have that good foundation to start the day, right?
Absolutely, yes. You need that good foundation of a good night's sleep in order to have a good day and be aware of things and be able to react to your environment and be able to think clearly.
Ever have any real surprises in the sleep lab that you're like, wow, I really just can't believe that just happened? Any kind of stories that you'd like to share with us of things that happened during a sleep study that were just really interesting or really surprised you? Yeah, I think probably the thing that surprises you the most is when patients will have what's called REM behavior disorder, rapid eye movement sleep behavior disorder. It's a disorder where people will act out their dreams at night. And so sometimes you'll see some very unusual things when people are acting out their dreams at night. That's probably one of the most surprising things you'll see. You'll also see some interesting sleepwalking things with kids studies sometimes. I've seen a kid who started to sleepwalk and the cords actually caught as she got up from the bed, so she just reached up and ripped all the cords off and then wandered out of the room. And completely unaware at
the
time.
Had no idea what she was doing. And so yeah, you'll see some very interesting things like that. I mean, the parasomnias is usually what makes you kind of go, wow, look at that, that's amazing.
Well, you talked earlier about what got you interested in the first place, just some of your own personal experiences with sleep. What keeps you in this field every day and just always still enjoying what you're doing with the Sleep Center?
Well, it's very challenging. There's lots of different sleep problems out there. You mostly see sleep apnea, but you see a lot of other patients who have things like narcolepsy and restless leg syndrome and insomnia. And it's a very interesting field. It's always growing. There's always something new, some medication that's new, some new piece of equipment that helps you better diagnose patients or makes it easier to treat their sleep apnea. So it's an exciting field. And you go to the big sleep conference every year, and at the sleep conference you learn about all sorts of new equipment that's coming out and new advances that can help you better treat your patients.
Do you think, generally speaking, we are a sleep-deprived society today?
Oh, absolutely. We were definitely a sleep-deprived society. We have lights on all the time. I don't know if you've ever seen those pictures from space that the astronauts will take, but it's not dark. When you look at the dark side of the Earth at night, there's lights everywhere. And so we're doing a lot of things that aren't good for our bodies by kind of living this 24-hour lifestyle. We really need to think about that when we're making decisions about how we do things in the world, and try to make sleep more of a priority for everybody.
Because we're not wired really to do that. We're trying to do it, but we're not really wired to do that.
No, we're really daytime creatures, and we're trying to live like 24-hour creatures, which there aren't very many of out there.
Okay, very good. Thank you so much for sharing your expertise with us and teaching us a little bit more of how to improve our habits too and get a better night's rest.
Well, thank you for having me.
All right, thanks. And remember that advice from Dr. McWhirter. If you haven't fallen asleep after lying in bed for 20 minutes, get up and do something else, like read in a dimly lit room. Thanks for joining us for this edition of Up Close. We'll see you again next week. I'm Stephanie Aldrich.
Up Close is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.